All right. Good afternoon. Today, I'm joined by Lexington Mayor Linda Gorton, Harrison County County Judge Executive Alex Barnett, Mayor of Cynthiana James Smith, Secretary of the Cabinet for Health and Family Services Eric Freelander, our Commissioner of Public Health Dr. Stephen Stack, Dr. Mark Newman, the Executive Vice President for Health Affairs at UK, and Dr. Crystal Miller, who is the director of the WEDCO District Health Department that serves Bourbon, Harrison, Nicholas, and Scott counties. Yesterday evening, we confirmed Kentucky's first confirmed case of the coronavirus. At this time, we can confirm that that individual lives in Harrison County and is currently in isolation and receiving treatment at UK's Chandler Hospital in Lexington. This person was first treated at Harrison Memorial Hospital, and while the patient has been in serious condition, we have the good news that they are improving. At this point, we expect more cases of the coronavirus to be confirmed in Kentucky. And we believe likely we will have additional cases in Harrison County. Because of that, people either in Harrison County or across Kentucky should not panic, but instead should be prepared. And because of that, we're going to make a series of recommendations on social distancing in Harrison County. These are a significant and important step, but they are steps that are preventative and can help this community, and if we have to recommend it in other communities, to stop the spread of the virus. We are advised that the superintendent of Harrison County Public Schools will close the school system for at least a portion of a week, if not a full week, and we would recommend at this point that he do so. We are recommending that nursing homes in Harrison County close to visitors for the upcoming week. We would advise that public gatherings be delayed. But with all of that, we are not advising the closing of any business. What we are suggesting is engaging in social distancing, trying to stay about 6 feet apart, and then practicing good hygiene, practicing really, really good hygiene. Washing your hands, washing them well, washing them a whole lot more than you might have a month ago, and making sure that if you are sick anywhere in Kentucky, but especially in Harrison County, do not go to work. Despite this first case, and despite expecting more cases, the threat to Kentuckians is still low. But to be prepared, yesterday I declared a state of emergency to ensure we have all the tools that we need at our disposal. Our Emergency Operations Center is still at level 4 today. That is the lowest level, and that is the level that we were at yesterday. Additionally, Dr. Stack has activated the department operations centers at all the local health departments. We have announced our coronavirus hotline for anyone concerned, and that number is 1-800-722-5725. Additionally, we are loosening restrictions such as prior authorization on anything coronavirus related in Medicaid to make sure that we can provide the type of services that we need. I have assured both the judge here from Harrison County and our mayor that we will provide them with every single resource that they need and that we will be working directly together. In fact, I've now had numerous conversations with the judge over the last 12 hours or so alone. Additionally, we are working inside of state government to set an example by ensuring that we have sufficient paid sick leave for anyone that might show symptoms of this virus to be able to be away from work, but to be paid and maybe telecommuting for up to 14 days. That's even for employees that may have just started and therefore not accrued that amount of sick leave. We've got to make sure that we're doing this right inside of state government. Additionally, the CDC has put out some new guidance and that is that they are recommending anyone over 60 or people who have heart, lung, or kidney disease to avoid public gatherings as much as possible. That is significant guidance, and it's important that we pass that along. So this is new news today about expecting more cases. It's some significant recommendations on social distancing in Harrison County. But now is not the time to panic. We are prepared for this. And as they talk about it, Harrison County is prepared for this. We are going to get through this, and we're going to get through it together. And what we have to make sure is just because we engage in social distancing in any county, we do not lose our compassion. We are still helping each other. We are still checking on each other. This is something that we absolutely will get through. And when Kentuckians are faced with something like this, we always come together and we show what makes us so special. I'm now going to introduce Commissioner and Dr. Stephen Stack, who heads public health here in Kentucky.
Thank you, Governor Beshear, and thank you for your leadership and support as we work through this current situation. I'd also like to thank many of our partners, though I can't thank them all by name. I'd like to thank Dr. Crystal Miller from WEDCO, who directs the local health department, Dr. Craig Humbaugh from Lexington, who directs his local health department, and the many other leaders and clinicians who are involved in treating this patient and any patients we may encounter in the future. I want to emphasize what the governor has said. It's absolutely essential people remain calm. We're going to get through this. We've gotten through things just like this and even worse in the past. We're going to get through this, and we'll all be okay when we get to the other end of this. It is important, though, and I want to urge for people to be informed and for people to take active steps. We'll do the very best we can to get information out to everybody and try to give you the best and most reliable guidance we are able. But we need people to make an active effort to go find that information and make use of it. So we have our website up here on the screen. So it's kycovid19.ky.gov. So spelled out kycovid19.ky.gov. If you could please go there on a regular basis, you'll find both local resources specific to the state of Kentucky and also links to the CDC guidance. At the top, we'll update as frequently as we are able information relevant specifically to the Commonwealth of Kentucky. You will see up here is during this press conference it being updated, where beneath there will be specific guidance for residents of Harrison County and other additional guidance very unique to the communities who may be affected by the condition. If you are responsible for populations of people, that may be schools, businesses, healthcare facilities, public gatherings, I would ask that you please go to that website, identify the community closest to the description that you are responsible for, read the information, and begin planning. Things like telework and virtual classrooms and virtual work are very, very important. And as the governor has said, it's very important that employers be as absolutely supportive as possible for an employee who may be sick, to allow them to stay home, to stay away from spreading infection to others, and if possible, to work at a distance so they continue to be productive if they are able. We will get through this. I thank everyone for their leadership, and I thank the governor for his support.
Thank you, Doctor. Next, we're going to hear from Harrison County Judge Executive Alex Barnett.
I first off want to thank the governor for his leadership. Harrison County wants to be first in a lot of things, but in the coronavirus, we didn't want to be. But unfortunately, that's what happened, and we've been preparing for over a month, working with Dr. Miller at our local health department, working to be prepared in case coronavirus did come to Harrison County, and unfortunately it has. We have had a team meeting this morning. I got everybody up early on Saturday morning in Harrison County. All of our leaders came together and talked about what we're going to do to tackle this head on, and that's our plan. We're working everywhere to do everything we need to do to minimize the impact that this is going to have on Harrison County Once again want to thank the governor and all the people from the state that have reached out to us and offered help. And I want to encourage everyone in Harrison County and all across the state not to panic. As everyone says, we are going to get through this. We've got one case right now. We're expecting more. We're working closely with our hospital to test people in Harrison County, and we are going to be all right. And I want to thank everyone.
Next, we have the Mayor of Cynthiana, James Smith.
Thank you very much, Governor, for your extension of the resources that we need in Cynthiana. We already have the best resources that we need, and that's our people. As we had our team meeting this morning, and I looked around the room, everyone in that room was professional, and we weren't motivated by fear, but we were motivated by facts. And because we have the right people in place, and because we work so well together in Harrison County, not just on the leadership level, but the people as well. We come together when there is a crisis, as we've seen time and time again, and we will come together for this as well. So do not be afraid, my fellow Cynthiana and Harrison County citizens. We will get through this together, and we will be better for it. Thank you, Governor.
Thank you, Mayor. Next, we have Dr. Crystal Miller, who is the Director of WEDCO, which serves Harrison County. Let me tell you, this underscores the importance of our local health departments and the amazing people who work there, and Dr. Miller is one of the best.
Thank you, everyone. As the first local health official to experience this, and we are expecting more cases, we got the call yesterday about 4:30 confirming our first case in Harrison County. We have been working around the clock to provide education, get our community partners around the table to discuss next steps. To reiterate everything that's been said here, as the public health official for Harrison County and preparing for another case there potentially, I urge you to be flexible in everything that you do. Be creative. If your employees are sick, please be flexible with them. It's a time for us to enhance social distancing. We worked this morning with the community partners, and the hospital CEO, Sheila Kearns, and I worked out a plan for her emergency room to receive patients who are experiencing symptoms. So if you are in Harrison County and you experience symptoms, we urge you to go to the emergency room, and they will follow protocol from there. As the public health official, again, still practice protective hygiene, proper washing of hands. If you can't use hand sanitizer, if you can't use water. If you're sick, please stay home. And then if you cough and sneeze, because this is a respiratory disease, please cough into your elbow. And we will share any information that comes out through Harrison County on our Facebook page, WEDCO District Health Department. So please like that page. We are keeping information flowing from there, in addition to these extra websites. Thank you, Governor.
Next, we have Lexington Mayor Linda Gordon.
Thank you so much, Governor Beshear. I greatly appreciate your leadership and your proactive position on all of this for Kentucky. Just a couple of things. In Lexington, I have declared a state of emergency. This will enable us to access any resources that we might need. And we have been working for quite some time with our stakeholders in Fayette County, and we have a network already in place of these stakeholders who are sharing information daily. On our lexingtonky.gov website, we have on our homepage the word COVID-19 so that our residents can click on there, and we have linked to many entities such as the CDC, the Health Department, all of those, our transportation, our universities, so that citizens can get the most updated information. We are ready and prepared in Fayette County for this, and we'll do whatever we need to do to be supportive of those around us and as we move through this. Thank you very much.
Thank you, Mayor. And next, we have Dr. Mark Newman, who's the Executive Vice President for Health Affairs at the University of Kentucky.
Thank you, Governor. I just want to say that it's been phenomenal teamwork on an ongoing basis as we look at, how we have responded and how we have prepared. So I think we're ready. UK Healthcare is ready and has the resources to take care of many of the sickest of these patients. And our hospital is designed with substantial isolation capabilities so that we can do this in a very safe way for both our patients and our people. So people don't have to worry about coming to UK Healthcare or worry about infection. And again, we want to protect our other patients as well as these patients coming in with the coronavirus. And we also want to be sure that we take care of our own employees and our own healthcare givers as we go forward. I think the last thing I want to say is that as we look forward, we want to be a resource, but the majority of these patients are going to be treated in their local hospitals and in their communities and some at home. And I think that's a key component for people not to panic, as we're saying, to be able to go through that the normal progression and that we're going to come through this in good shape. Thank you.
So I hope what the people of Kentucky see here today is preparation, cooperation, and coordination. Now, it's been less than 24 hours since we had our first positive test, and we already have local and state leaders, our local health department, our state Department of Health, working seamlessly and absolutely committed to doing whatever it takes to help our people to get through this, and we will. As long as everybody stays calm, remains compassionate, and engages in good hygiene, we're going to be okay, even though we're going to have to take steps as we move forward just to make sure that we protect our people. Always have to put it in context. While we expect more confirmed cases of this coronavirus, we have about 19,000 confirmed cases of the flu here in Kentucky, and we have had 66 deaths, including 4 pediatric deaths, 4 kids. So, in addition to everything that you need to do to protect yourself from this new virus, get your flu shot and make sure that you treat the flu as serious as well. Finally, I want to thank the media who has helped us get the word out. I appreciate how you have focused on the hygiene portion of it. We need you to continue to do that. This is one of those times where our mission, I believe, isn't just to report the news, it's to help people out there through the dissemination of information. And given that the threat is still low, what I'd ask of our media is just to be thoughtful and intentional about how you report. Sometimes people will only read one line of a tweet or one tweet itself and not get the rest of the context. And fear can cause things to happen that we should all want to avoid, and fear and widespread fear could be much more negative than anything we see coming out of this virus. So we just ask all of us, let's make sure we're responsible in how we're communicating. So with that, we take any questions.
Governor, yesterday you gave us the number for the Poison Control Center as an information number. You gave a different number today. Which one?
This new number is what we should be using. It is up, running. We're moving fast. And so all the steps that we take, we may have to go back and fix a few things as we go, but we're moving really fast, but we need to. So that new number again is 1-800-722-5725.
And do you have any more information available on the travel history or what have you of the terrorist?
Right now, the information we confirmed is all we can confirm, and we intend on providing more. We just got to give those epidemiologists we talked about yesterday enough time to do their work, to make sure that any facts that we're able to put out there, we can put out in context too, and that we have reliable information.
Governor, can you walk us through the time frame for this case? So when did this person begin showing symptoms? When did they go to the local hospital? How did they make it to Lexington at the UP hospital? What can you tell us about the timeline of how this has progressed?
Well, let me ask Dr. Stack to step up and provide the information that we can. Again, we will be providing updates. It's likely that we will provide another update tomorrow. Our goal, again, is we believe that if we're here every day talking to the public about what we're seeing, then hopefully we keep everybody calm but prepared. Dr. Stack?
Thank you. So those questions about when someone became sick and when they sought care, those are all very important. They're the very questions that our epidemiology team are looking into. I want to offer to that question and to everybody who's listening a couple of thoughtful responses about how we're going to handle that. First and foremost, our commitment is for any patient who's sick that they're going to get the treatment they need and that we're going to help them get well. And so we have privacy considerations for the individual patient and their families. So you will find that I am going to tell you over the course of our response to this situation that there are some answers that I will not provide you out of respect for the patient's privacy and their family. As we get information that we can publicly share and that helps to inform communities to be responsive and to keep themselves safe, we will share that information. We just found out about this patient last night. The epidemiology team is hard at work contacting and identifying anyone who might have come in contact with the individual. And so when we can share that information in a way that is useful to the public, we commit to you to share it. I have one other thing I'd like to ask your help with. If you are sick, please call your healthcare provider. Try to use the telephone first. If you have virtual access to care, telemedicine and things like that, please do that. Social distancing means social distancing, trying to minimize congregation of people. If you are just concerned, please call the 800 number the governor has told you or reach out to your clinician by phone. Don't seek medical care if you would not otherwise have simply because there's coronavirus. If you feel you need medical care, though, of course, please seek that. But as far as reassurance, please use the other avenues available for reassurance that don't require congesting hospitals and doctor offices and congregating people that may not be beneficial.
One last piece of news is we're working today to activate, and we talked about it yesterday, to activate the price gouging statute. And that would apply to all the equipment related to prevention or that's otherwise necessary.
Governor, can you address just why we expect more cases in Harrison County? Do you know how many people may have been exposed?
We're still working through all that in the short time frame, but it's our belief based on the information that we have now that we will see some more cases, and we want to make sure that the public is ready for that knows that it is expected, that sees how prepared the county and the city and the local health department are, that we reassure those in Harrison County and elsewhere, because I believe we're also going to have positive cases elsewhere. It's where we think this is going, that the state is providing every single resource.
Do we have an update on the number of people who are being tested?
That will update at 4 o'clock today. It was 10 as of the end of yesterday, with 1 positive, 9 negative. I believe it'll be at least 14 by the end of the day, but we want that number to be accurate.
Okay, and then Dr. Stack, you mentioned how you want people to use the telephone first. So is that like, so if somebody feels like they're sick, they should call someone rather than just show up to the ER? Is that what you're saying?
Right, so thank you for the question. I want to be very clear about this. If you feel you have an emergency, seek emergency care. But if you have a fever or a cough and you otherwise feel fine and you would normally take Tylenol and stay home and rest, please take Tylenol, stay home and rest, and then seek guidance by telephone or other means. In a situation like this, people's fear of the unknown often outstrips what fear is really justified. So if you would not normally seek medical care or not normally go to an emergency department or a doctor's office, continue to behave as normal. But if you feel you have an emergency, by all means, seek medical care as you feel you need to.
And then the other thing I wanted to follow up on, you said people were being contacted. So right now the epidemiologists are contacting people.
They've been working ever since yesterday evening, and they continue to work. As you can imagine, any of us in the community interact with a lot of people on a regular basis, so they try their very best to build out that web of contacts so we can advise everybody who needs to be advised.
Dr. Stack, how is the state doing with test kits?
So I wish I had, I don't have an accurate number to tell you at the moment. I can tell you this. The state of Kentucky has all the test kits it needs to test everyone we need to test at this time. And the CDC has made additional resources available, so we have the ability to order additional test kits. And additionally, commercial labs have already announced availability of the test. So we hope that very soon, people will be able to seek routine medical care and get a test from their doctor, nurse, or other clinician, just like they would for the flu or other important tests.
And to add on what we talked about yesterday or the day before, as the commercial labs, private insurance are able to do testing, the number of actual tests will skyrocket, and that doesn't mean that the number of people that necessarily even show symptoms has increased. And to add on to what Dr. Stack is saying, you sit in a room full of people at this time of year, a quarter of them are going to be coughing from time to time. Just because you're coughing doesn't mean you ought to be worried about this coronavirus. Again, we have one confirmed case in Kentucky. While we believe we'll have more, 19,000 cases of the flu puts it into context. We want to be prepared. We want to be. I mean, we want to be responsive and we want to be responsible. But what we don't want to do is build fear. Yeah.
Getting the flu shot, if you've already gotten the flu shot, does that lessen the flow?
If you've gotten your flu shot for this year, thank you so much. Everybody needs to get the flu shot unless there is some medical reason that they cannot. But with the flu being that much deadlier right now than the coronavirus in Kentucky, just in numbers of cases and the fact that we have had deaths, we can't talk about something related to public health without talking about the flu and getting that flu shot.
Regarding the school closure, can you talk more about when that decision was made, and is this a preventative measure, or did this individual come into contact with schools or students or teachers?
Well, I want to let the superintendent, when that's announced, I believe it is being announced, respond to those issues. I would say that it is a preventative measure at this point.
Given that we do have a case in
Tom, let me answer this one and I'll come.
In Harrison County, there's a lot of speculation about where this person worked, and that speculation is creating fear in itself. Is there any reason, or do you know when that might be released, or why it's even being withheld?
Our hope is to release additional details in the coming days. The concern is that the epidemiologists that are tracing contacts would not have the time necessary to reach out and to reach those folks and to gain both facts and perspective about it. We intend to be very transparent, but we need to follow this same process that's been used so many times before. I understand people are scared. I do. And I want them to feel confident in the local response and in the state response. We will get through this. Even though we will see other cases, we will get through this. We'll do it because we take care of each other, and we'll do it because we're going to put every single resource that's necessary. I've talked to the judge on my cell phone more than a couple times since yesterday evening, and actually ducked out of a big event to make sure that we talked at that moment. The people of Harrison County ought to know their governor and their state government are right there with them. We're not going anywhere.
As Tom, we have a case, are there already contingency plans being put in place to perhaps close down parts of state government or perhaps even this building?
So right now, we don't see any need there. Now, we are making sure that in state government that we're adjusting our sick leave policy to ensure that people who are sick can stay home. And the same thing I'm recommending to businesses that we are actually leading here in Kentucky. That person who's worked a week and hasn't accrued sick time in state government, we want to make sure that they are able to stay home. We'll respond appropriately when necessary, but I can tell you I'm going to be here working every day to make sure we're doing the people's business and that we are responding when things like this happen.
Governor, any additional state resources, are they being deployed in Harrison County right now, personnel?
At the moment, we're working very closely in hand with our local officials. I will tell you that they have their resources marshaled and ready. And the people of Harrison County are in very good hands, and the people of Cynthiana are in very good hands. But we have assured them that whether it's any testing, it's going to go to the front of the line. If it's any extra testing kits, they're going to have them. Whatever Harrison County needs right now, we're going to provide it. And I will do whatever is necessary to make sure not just that we're responding appropriately, but that the people understand and feel that we're right there with them.
Are those 4 pending cases in Harrison County, or are they from elsewhere?
We can't confirm where they are, but we get different test kits from different places. Again, we do anticipate additional cases in Harrison County, but we also anticipate additional cases elsewhere. I mean, any area where we have a dense population in Kentucky, by the time we're fully through with this, and we will, we'll get to the other side. We should anticipate that we'll have those cases.
Governor, what is the timeframe for when someone has been tested? How long does it take to get those results?
Well, we are very thankful that the state lab is up and running with the ability to turn this around. The CDC was taking about 24 hours. Depending on when we receive it, it is now down to 12 here in the state. And we're going to make sure that we're prioritizing and getting those tested. Now, for folks that a test has been taken from, they should already be in isolation. And our goal is to make sure that self-isolation or other isolation that we are doing in ways that are both humane to the individual, but ultimately protect the public as well.
Can you tell us anything else about this individual, sex, age, underlying condition?
We've released everything we can at this time in terms of where we are in the process, and also in terms of HIPAA, which has some real limits on people's health information and what you can release.
Question for Dr. Stack, if I can. Those people who are out wearing masks in public, understand that the mask really does not protect you from this type of virus. Is that true? Can you clear that up?
Yeah, thank you for asking that. That's really important. Wearing a mask, just in general, walking around like you see on videos and social media is not recommended. That's not proven to be helpful. The best thing you can do are the steps we've been telling you repeatedly, which are if you're sick, stay away from other people, wash your hands with soap and water, use hand sanitizer. When necessary, stay home from work or school if you're ill, and cough into your sleeve or a tissue, not your hands. The reason we say those things is because, and stay about 6 feet away if you can from folks who appear to be visibly sick, because a lot of these are droplet spread. So if you cough and you have some saliva, that's how most of these things are spread. So we would really recommend and actually ask that people not aggregate those masks, so they not take them to themselves so that they're not available for people who need them in medical settings and others who really do need them. So wearing a mask, just walking around in the general public, is not recommended by the CDC and is not felt to be protective.
All right. Any?
Do we anticipate to have the results of these pending tests tomorrow?
We believe that we will have updates tomorrow, and they will likely be included in this. And we anticipate that we'll likely be doing updates just about every day. I think that's the best way for the public to know that we're on top of this, and the way that people can if they want to, see the information directly for themselves. We here at the Capitol, I know in Harrison County and Cynthiana and all across Kentucky, are all hands on deck. We are, again, going to get through this together. We will be okay. We will take care of each other, and we're going to use every state and local resource it takes to do that. Thank you all very much.